Hello. We begin a discussion on the types of female pelvis. So basically, there are four types of pelvic shapes based essentially on the shape of the pelvic brim. The first one is going to be the gynecoid. The gynecoid pelvis is basically the normal female pelvis. And this gynecoid pelvis is going to be something like this. It's going to be something like that. That's going to be your gynecoid pelvis. The gynecoid pelvis has an inlet, which is transversely oval, and your transverse diameter is slightly more than the anteroposterior diameter, right? And it's going to be spacious in terms of the pelvic cavity. Then it's quite suitable for delivery, right? Then the next one is going to be the android. The android type of a pelvis is the normal male pelvis, where it's going to look more or less like this. This android type of a pelvis, it has an inlet which is heart-shaped, and the anterior posterior diameter is more than the transverse diameter, right? And if you look at it, the pelvic cavity is going to be funnel-shaped, and it's less roomier as compared to the gynecoid pelvis. This android type of a pelvis may lead to obstruction in labor, and the outlet is quite smaller as compared to the gynecoid pelvis, which is the normal one, almost 42% in totality, and seen in 50% of the females. Right. Then this android type is seen in 20% of women. Then there's the anthropod pelvis. Anthro meaning ape, oid meaning like. So it's an ape-like pelvis where you have an inlet which is compressed from side to side, and the anterior posterior diameter is quite great as compared to the transverse diameter. And this poses difficulty in delivery, right? And it may actually allow for easy delivery of an occiput posterior presentation of fetus, right? Then there is the platypaloid pelvis, which is the flat pelvis, seen in about 5%, 2.5 to 5% of all females, and its inlet is compressed anteroposteriorly, right? And it also poses difficulty in delivery, right? And there is arrest of fetal descent at the pelvic inlet, which leads to difficulties in parturition, right?